Okay, I'd like to invite our first panelists to come up to their seats. Am I kind of on schedule now? I don't know. We're running a little bit late. We're doing a panel on Social Security, Medicaid, and healthcare, and especially single payer. And I don't know, is Eric here? We might end up just starting with the single payer stuff, and maybe he was too late on the way, and okay, Eric. Okay. So, my single payer panelists. Recording this mic at some point. Ah, they're going to do a presentation? Oh, I didn't know this. These people are wonderful women that I met not so long ago. Some of them are from my Tompkins County Progressives group up in Ithaca. That's Margaret on the left, Margaret Fisher. She has been busy with her own health care issues since the 80s, worked as a director for a program for mothers and infants at a certified home health agency in Rochester, and she saw the effects of care delivery imbalance. Very wealthy people and very poor people, families got care, while the middle class and the working class families had a lot of trouble. So that was part of her motivation for getting involved on this issue. Susan, who's on the right, is a family doctor in Trumansburg, not far from Ithaca. And she's been a member of the PNHP Physicians National Health Program for 20 years. And she's been busy 10 years now with the single payer movement in Ithaca. Anita, who is second from the left, is a retired English as a second language teacher, and she has a lot of experience with the Canadian healthcare system because she lived there for 28 years. So she had Ontario Medicare for All, and she has a lot to share about that. And Carolyn was a clinical social worker in mental health services, and she had to work with insurance companies for 25 years. Made her crazy, I think. She has a lot of insights on that. I can't imagine trying to keep that up for 25 years. And all four of these people, and also many other people, are busy with a group called Finger Lakes Campaign for New York Health. So they're associated with the statewide campaign for New York Health. And I'm going to let them begin their presentation. Oh, it looks like it's on the board. Okay, great. And we'll hear from Eric when he gets here. Thank you.
Thank you, Emily. Good morning, everyone. Special shout out to my pals from Ithaca, Trumansburg area, and all of us New Yorkers. If there was ever a Medicare for All moment, it certainly is now. I'm going to speak to why we can't just reform the Affordable Care Act, why we need New York Health, Medicare for All type health reimbursement plan for everyone. This first slide is kind of an overview of how the wealthy countries in the world organize healthcare. And you'll see in the left upper corner a plan that uses public funds but private delivery. And models for that are our own Medicare system and the Canadian system. And we refer to that as single payer because all of the funds get funneled into one revenue stream that's publicly administered and covers everyone. Below it is a plan that uses public funds and also has public delivery. And models for that are our own VA system, as well as the system in the UK. And we refer to that as socialized medicine, because all the providers of healthcare, the docs, hospitals, nurses, are all employees of the government. In the right upper corner is an all-payer system. It's a very highly regulated, non-profit, but private insurance plan, and Germany is a good example of that. In the right lower corner, an example, maybe a negative example of US exceptionalism, because we are the only wealthy country that a multi-payer system that's modestly regulated, with very high costs, large coverage gaps, a market-based mix. And yeah. So the Affordable Care Act is a reform of this market-based mix of private insurers. It's made some advances, and the threat of the repeal has really highlighted those advances. It's increased the number of insured by 20 million through Medicare, Medicaid expansion, and subsidies. Can you all hear me now? And it's also removed some former barriers to care that the insurance companies themselves put up, like pre-existing conditions, and somehow managing to charge more for premiums to women than to men. And those are the barriers to care that the Republicans refer to as access. Nobody's talking about removing the financial barriers to care. The ACA left the private insurance industry, it was really a gift to the private insurers, intact with its complexity, inefficiency, and profit-driven bottom line. The market promised us more efficiency, competition, choice. But what we've seen, even with the Affordable Care Act in place for several years, costs have continued to rise, healthcare benefits are worse, provider networks are narrower, and millions still remain uninsured, and more people find themselves underinsured, with mounting out-of-pocket costs and unable to afford care. All this while the insurance companies walk away with huge profits. And it would be one thing if all this money we spend actually had good results. We now, as you probably all know, we now outspend every other wealthy country in medical costs per capita and have some of the worst health outcomes. We score 51st in the world in life expectancy and score poorly as a nation on many other health outcomes. So this is a life expectancy graph, and you can see the difference between the US on the left at 78, 79, and is it Italy on the right at almost 84? So there's almost 5 years difference in life expectancy. Our maternal mortality rate is 3 times that of Canada, and that's the rate that women die in childbirth or close to the time of childbirth. There was an unprecedented rise in maternal mortality between 2000 and 2014, when some states opted out of Medicaid expansion. It shows that mothers die when they can't afford prenatal care. And you can see that in Texas, for example, the maternal mortality rate doubled within that period of time. Many other studies show that no insurance and underinsurance lead to poorer health outcomes. In spite of the Affordable Care Act, almost 29,000 deaths in 2015 were directly attributable to lack of insurance. These numbers will only rise. I computed how many unnecessary deaths there might be because of lack of insurance in our senatorial district, number 58, and there turned out to be 27 unnecessary deaths, just in our small senatorial district. In this country, we also have rising rates of health disparity based on race, as well as income. Blacks die younger, partly due to lower median income. Black women get worse obstetrical care and have worse OB outcomes. The consequences of heart attack, stroke, and cancer are worse for African Americans. This, again, is in spite of the Affordable Care Act. In the VA system, socialized medicine, where everyone has equal medical coverage, all these disparities disappear. In the Canadian system also, which is affordable and universal, mortality gap by income is shrinking. The cost to us of increasing illness and treatment based on emergency rather than primary and preventive care is unsustainable. Our excellent medical delivery system, if available to everyone at a reasonable and just cost, would make us healthier and in turn cost us less in the future. We already have an affordable, universal, comprehensive, successful system in place, and that's Medicare. The New York Health Act is an expanded and improved Medicare for all type system. Its low administrative costs and cost savings to providers is enough savings to cover everyone. And the last slide is just a summary of the Affordable Care Act drawbacks versus the New York Health Act, affordable, simple, universal, everybody in, nobody out, comprehensive, accountable to a public board, and no rationing of care based on pay. Our country would be healthier, our economy healthier, and more sustainable. Providers, like myself, will be happier to be able to treat everyone and save administrative costs and headaches. So the idea would be to keep the Affordable Act in place, hopefully we can, until we have a system that works for everyone.
I'm going to briefly go over
It's closer to the sound a little clear in the back.
Okay, is this better?
Yes.
The people in the back, just raise your hand at any time if you can't hear me.
A little more,
Closer. Is that right?
although I know if you get too close and it's a cry. I know.
I'm going to briefly go over the basics of the New York Health Act. How many of you know enough about the New York Health Act to explain it, at least superficially, to someone else? Okay. Yeah, that's great. Okay, so as Susan was saying, the New York Health Act is a state bill that would establish a healthcare system in New York similar to an expanded and improved Medicare. That's why we say Medicare for all, everybody in, nobody out. Every resident of New York would automatically have their health care covered. Having access to health care would not depend upon your being employed. Unlike Medicare, it would not depend upon your age, and it would not depend upon a person's ability to pay. You would no longer need an insurance plan. You would no longer have to worry about getting insurance or how much your insurance would cover. All New Yorkers would have access to health care the way we have access to fire departments, schools, and libraries. Today, insurance companies make billions of dollars using our health. The New York Health Act makes health care a human right, not a commodity that generates profits for the wealthiest people in this country. In Canada and in the rest of the world, it is understood that to be an enlightened and compassionate society, there must be universal health coverage. The New York State Assembly, as many of you know, passed this bill in 2015 and 2016. The bill is now in the Senate Health Committee. We need 32 votes in the Senate to pass the bill, and 27 senators have already signed on as co-sponsors. So we only need to convince 5 more senators and the Health Committee that businesses, farmers, local governments, and residents of New York need the New York Health Plan. Under the New York Health Plan, you would no longer receive doctor's bills or hospital bills. That paperwork would just disappear. There would be no premiums, no copays, no deductibles. No premiums, no copays, no deductibles. New York Health provides comprehensive coverage for all medically necessary services, including primary and preventative services, prescription drugs, specialist hospitalizations, women's health, and mental health, dental, vision, and medical supply cost. Does this sound too good to be true?
Yes.
Really?
That was my first reaction when I heard about it, and it's actually a common objection that we hear from New York State senators. So just keep listening, and Anita will talk about the tremendous savings that will occur under this bill, and Margaret will talk about the finances and how it will be paid for. One of the scare tactics that private insurance companies have used for years is to say health care will be rationed by the government. The truth is that private health insurers, not the government, ration and restrict our health care.
Yes.
You've experienced it.
Oh, yeah.
Oh, yeah.
They do this by limiting access to care because many people simply can't afford it. They also do it by charging high deductibles and copays that discourage people who do have insurance from getting care. They limit patients' access to doctors and providers to their own individual companies' networks. And they also limit access to health care by overruling or denying payments for doctors' treatments.
Yep.
New York State will not ration or restrict health care. New York will not have restrictive networks. You choose your own doctor. Under New York health care cannot be denied. Coverage cannot be denied for any health care your doctor prescribes. New York Health returns control of your medical care to you and your physician. Physicians will no longer have to call an insurance company for approval. The patient and doctor are in charge. Another objection we hear is this is socialism, or this is socialized medicine. New York Health is not socialized medicine. Socialized medicine is a system where all healthcare providers become government employees. And as Susan referred to, that's the Veterans Administration in this country. Under New York Health, your doctors and other practitioners remain privately employed, just as they are now. The doctors and other providers would be far less restricted under New York Health than they are now, with insurance companies determined to make huge profits from health care. Under New York Health, all health care would be paid for from a single public trust fund that is administered by the Commissioner of the Department of Health and overseen by a 17-member board of trustees, the members of which would include representatives from healthcare consumer advocacy organizations, professional organizations representing physicians, professional organization representing practitioners that are not physicians, representatives from hospitals, including one public hospital. There will be representatives for community health centers, healthcare organizations, organized labor, and representatives from the State Assembly and State Senate. With New York Health, every resident in this state can be assured of having health access to health care without fear of going bankrupt. New York Health will provide peace of mind and a sense of security. This is not a matter of left versus right, it's a matter of right versus wrong.
Let's see, can you hear me?
Yeah.
All right. So I grew up in the United States, and I've been living here the last 15 years, but for 28 years I lived in Canada, in Ontario, and I was covered by the Ontario Health Insurance Plan, which is a Medicare for all plan, or also called single payer, like that proposed under the New York Health Act. So I just want to talk a little bit about my experience and reinforce some of the points that Carolyn made. This system worked incredibly well for me and my family and for all my friends, and continues to do so today. I keep in touch with what's going on up there, and I have family that are living in Canada now. We received excellent health care. It was easy to use. There was no troublesome paperwork for copays and deductibles, because there are no copays and no deductibles and no premiums and no bills for $2.10 that arrive 6 months after your treatment. I see some heads nodding about that. There were no restricted networks. We chose our own doctors who worked privately, not for the government. We were covered for any procedure that was prescribed. Our doctors did not have to spend time fighting for the benefits. Now, when I grew up in Kansas, I remember an incident when I was a kid where I went to the swimming pool, and a boy about my age fell off the high diving board, and he hit the side of it, and he was severely injured. And he said, "Don't take me to the hospital, my parents can't pay for it." And I remember it being very upsetting at the time, but I didn't quite realize the significance of it until I came to live in Canada and I had my own kids, and I thought, nothing like this could ever happen in Canada. No kid would say this. They know that they would be covered for health care. So I was really so thankful for that system. You know, Canada spends about 60 cents per capita of what we spend in the United States, and yet its health outcomes are as good as, and sometimes better than those in the United States. It has higher life expectancy, lower infant mortality, and as Susan said, lower maternal mortality. My grandson was born about 4 months ago in Toronto, and he was several weeks overdue, and he weighed in at 10 pounds 6 ounces, so it was a rather difficult delivery. And yet my daughter-in-law received home visits leading up to the time she went to the hospital, excellent care in the hospital, home visits again after the baby came home. And all of this was just automatic. She didn't have to worry, did I check the right option on my plan? She was just going to be covered for whatever she needed, and the baby as well. So under the New York Health Act, we can cover everybody, just as is done in Canada. And we can save, according to a financial analysis, $45 billion every year in the state. Cover everybody and save $45 billion a year. And I'm going to talk about two things that can contribute to that. One is maintaining low costs for administering the system, and another would be savings on prescription drugs. You know, private insurance takes about 25 to 30 cents out of each healthcare dollar you spend, 25 to 30 cents. Compare that to less than 5 cents for the Medicare in the United States and about 5 cents in Canada. And why is it so much simpler in the Medicare for All system? Because it's one fund. It's just much simpler to administer. You don't have to deal with hundreds of different policies and options. So I wanted to take a look just a minute at a graph which shows where your healthcare dollar goes. So I'm not sure I can use the pointer from here very well, but if you look at this segment right here, so that's the segment that's for the private insurance industry costs, and that includes executive compensation and shareholder dividends. And that takes 11 cents out of your healthcare dollar. And so here's some private insurance CEO compensation examples. Aetna, $15 million, Anthem, $13 million, Cigna, $14.5, Humana, $10.1. So that money goes to those CEOs, and then the companies also pay out profits. So there's 11 cents gone out of your healthcare dollar already. And then above that, we have the private insurance benefits and billing. So those are all the people who work for the private insurance companies, and they're the people who process the claims that come in and deny benefits so that they can increase profits for the company. That's another 8 cents. We're almost up to 20 cents already out of your healthcare dollar. We could be spending these dollars for real health care. not on complicated filings, not denying claims, and not advertising. You know, in Canada, there's no advertising for doctors or insurance companies or drugs. There are no drug ads on TV in Canada. So above that, there's another 4% that goes to your doctor's office in order to handle all the billing and coding that they have to do to deal with the private insurance company. So they have hundreds of employees who try to handle these varying co-pays and deductibles and requirements. And in Canada, there's just one fund to deal with in your province. And it takes a Canadian doctor about 15 seconds to do the billing. So they also don't spend time fighting with the insurance companies for benefits, because those are just automatic, whatever they prescribe. And then above that, you have money that goes to the hospitals that also have to deal with billing. And they take another 4 cents out of your dollar. Here's a quote from someone who spoke at the healthcare hearings in 2008. He said, "We have 900 billing clerks at Duke Medical School, and it's a 900-bed hospital, so we have a billing clerk for every bed, but we don't have a nurse for every bed." And I can tell you that in Ontario, in Toronto General is a hospital of more than 400 beds, and they have something like 5 billing clerks. But in Cayuga Medical Center in Ithaca, which is less than 200 beds, they have like 25 people in the billing department. So a lot of this money is just going for unnecessary paperwork. U.S. hospitals spend about 25% of their budget on this administrative work for coding and billing, compared to 12 cents in Canada. So when you go back, then the red part is actually medical administration costs, which would be scheduling and medical records and that kind of thing in your practices. So there's 65 cents left for medical care. But think of that huge hunk, 27 cents, that's being spent for paperwork. So the bottom line is, with a single payer system, with the Medicare for All system like New York Health, we could actually put more money into healthcare. And then in just a couple of examples in terms of prescriptions. The US has the highest drug costs of any country in the world. And here's a couple of examples. Crestor, which you've probably heard of, is a cholesterol-lowering drug. It costs $32 in Canada. If you have insurance in the US, you pay $86.47, or your insurance plan will. And if you're paying for it out of your own pocket, you're going to pay $215. Humira is another one, which is used in a variety of diseases like arthritis, I think, and psoriasis. It's expensive, $1,165 a month in Canada, $2,500 in the US with insurance, or $3,430 if you're paying for it out of your own pocket. So those are ways we can save money. So just a couple of other points again to reinforce what Carolyn said. For one thing, businesses could save money. You know, businesses in the United States spend $2 billion a year just searching for and administering healthcare plans for their employees. They wouldn't have to do that anymore. They wouldn't be responsible for that. A portion of our property taxes goes to pay for the Medicaid mandate. That would all go away. The budgets of municipalities contain the costs of healthcare coverage for municipal employees and for school employees. All of that would go away. Those people would just be covered already. Healthcare costs are a major cause of bankruptcy in the United States, even for people who have health insurance. Nobody has medical bankruptcy in Canada. It would just be unheard of. And no one in Canada would ever think that they need to hold a chicken barbecue to pay for a child's cancer treatment. People are just covered, you know, for what they need. People in Canada don't worry about changing jobs or losing their jobs in terms of their health care, because health care is not tied to employment, and it wouldn't be under the New York Health Act, so people wouldn't need to worry about that. And so, you know, I think just the bottom line is that A Medicare for All system like the one I used in Canada gave me peace of mind. There just wasn't any anxiety about health care. And we could have the same thing here in New York. My direct experience with the Medicare for All system in Canada was excellent, and I continue to keep in touch with people up there about it, and I know no one up there who would consider changing to a system like we have in the United States. Based on my experience in Canada, I believe that the New York Health Act will give all people in New York peace of mind. It'll cover everybody with excellent health care, and it'll save us money. And one thing to keep in mind is that this system in Canada started in one province, in Saskatchewan, and we could do the same thing in New York, get a Medicare for All system here, and hopefully it could spread across the country. So I urge you to get involved in making New York Health happen.
Hi, I'm Margaret Fisher. First of all, I'd like to thank Susan Beckley, who actually did these slides to demonstrate the financial aspect of what the money really means for the New York Health Act. The first slide shows, and this is based on a financial analysis by what's his name? Gerald Friedman. UMass Amherst, who also, by the way, did a financial analysis for single payer for the whole United States. It's really worth taking a look at. But for New York State, and Susan did double check these figures with him directly to see that they were still current, still up to date. So at this point, the cost for providing health care in New York State, the total funding costs are, let's round it up to $255 billion. Where does that money come from? Well, the federal government and Medicaid, Medicare, etc., provides let's call it $164 billion. So the revenue needed by New York State to cover the difference is $91 billion. Where will that come from? Well, probably the most significant thing for people to think about is the progressive payroll assessment contributions. And they would come up to $59 billion. Then non-payroll assessments, and that would be dividends, interest, capital gains, etc., those contributions. They also have a graduated, they would have a graduated interest rate, and they would come up to $32 billion. So the total New York Health Act assessments revenue would add up to about $91,500,000. That would leave a surplus, or cushion, however you want to describe it, of $254,000. I'm sorry, $254 million. Thank you. Susan's the number person, but I'm doing my best. Okay. The next slide, let's go to the next slide. That's going to demonstrate how the payroll assessments work. And again, these percentages also apply to the interest income, etc. And, well, I'll back into that in a minute. But let's start with an example. Let's start with, sorry? Oh, well, okay, let's start with anyone making less than $25,000 a year, or about $12 an hour. Their total monthly cost would be nothing. Their employer's cost per month would be nothing. As far as increasing, well, the first level would be a 9%. People would pay 9% starting at starting at $25,000 or $25,000, between $25,000 and upward. But so if someone earns $31,200 annually, or about $15 an hour, their cost per month is $46.50. Their employer's cost is $37.20. I think we can go to the next slide, which will show. Well, as part of that previous slide, though, for those who are self-employed, their rates would be the same. They would, from $25,000, they would pay, at $25,000, they would pay 9%. This explains how the employees and employers would pay for the New York Health Act. The first $25,000 of wages and salary, there'd be no assessment. Above $25,000, a graduated payroll deduction begins at 9%. Employers would pay 80% or 7.2% from $25,000 to $50,000. Employees pay 20% or 1.8% from $25,000 to $50,000. Self-employed, sole proprietors, and freelancers pay based on income also, but 100% of assessment. Not private insurance company based where one rate fits all at this point. For employers, the benefits of this plan basically limit the playing field for recruitment because many people look for jobs based on the benefits. So if an employer is looking for an employee who can actually do the job that's required, but some other company, because it offers a different benefit package, that potential employee would most likely apply someplace else. This plan allows for people to choose where they want to work, not based on the need for benefits. Employers would be contributing to a system that not only helps provide health insurance coverage for their employee, but for that employee's family. So all of New York State and its families would be covered. Employer benefits would also include the ability to budget health insurance expense annually. Right now, as an offshoot of this industry-based, profit-based system, there are brokers who make a percentage of money off introducing these plans to various employers. So it's become a very, not complicated, but very time-consuming, very competitive-based part of the industry. It's just people making more and more money and taking more and more cuts out of the system as it exists now. It would also provide employers with the opportunity to recruit out-of-state workers to move to New York State, and it would certainly provide a major decrease in health insurance administration. And just so you're clear on how this table actually works, the assessment based on income bracket starts at 9% for those who earn $25,000 to $50,000. It caps at 16%. That's for people who earn $200,000 or more. What it would cost them would actually be less per year than what they're likely paying for for example, their platinum plans. So this is a contributory and step-by-step table. Okay. Yep. Okay.
All right. I'm sure people have lots of questions, but I'm going to ask you to try to remember those questions so we can hear Eric first, and then we'll do Q&A up until the end of our segment as much as we can. I'm going to introduce Eric real quick. Eric is a professor of social work at Syracuse University, co-founder of Social Security Works, and Strengthen Social Security Coalition. He's written articles and books for academic and general audiences, and his most recent book, co-authored with Nancy Altman, is called Social Security Works, Why Social Security Isn't Going Broke, and Why Expanding It Will Help Us All. And Eric ran a successful but ultimately losing campaign for the Democratic nomination in CD 24. I was helping him. I went door to door for Eric. Up in Syracuse, he was endorsed by Bernie. Bernie came and did a rally for him. And after that, Eric was also serving on the platform committee for the DNC campaign in Philadelphia. So thank you, Eric. Yes, please, that's good.
Guess I need the clicker. Getting some exercise. Actually had exercise because I had to find some parking. So, first of all, thank you for putting this together, everyone who's done it. It's really important. And this is the start of a great organization. And thank you also for the summary of the universal program we are all working for and pushing for. I want to say something. It applies to Social Security. It applies to the New York Universal Health Care Act. Numbers are important. All sorts of data are important. But at core, and I think this was expressed up there, it's a set of values. It's the kind of world we want to have that's core. The money is a means to an end. It's important. And I'll say that for Social Security and other things. So, what do I have, about 10 minutes? Because I'm going to summarize.
15.
15,
Well,
okay.
No, we wanted some questions, so how about we give you 6 minutes?
6 minutes? Well, the white clicker. Diane's getting some. Well, we're at it. To the flag.
The right one is forward.
Okay, here we go.
And then there's a laser pointed up center.
If there were a lot of time, I would ask you.
I think you have to turn it on the side. I have to turn it on.
Yep. Oh, no, it isn't. Yeah. Here we go. We're good.
There you go, okay.
So, I would ask you who said these things. I'm going to go really quick on this, though. Who said, you'll never guess who this person is. And this, he who must not be named. So who said, and it is my absolute intention to leave Social Security the way it is, not increase the age, and leave it the way it is, or as is. I would never support what has to be the craziest idea in the history of the US politics, allowing the government to invest Social Security retirement funds in the stock market. Not only would a market downturn spell disaster, etc. Any idea who that is?
Bush.
Who said the solution to the great Social Security crisis couldn't be more obvious. Allow every American to dedicate some portion of their payroll tax into private accounts. Our president, or what, I don't call him my president, I have to say. This is this is a context piece. We're living in a very unusual time, and I do respect the office of the presidency, but I think we have an illegal occupant in it. And absent an apology for the racism, the anti-immigrant language, the misogyny, the ignorance, the nastiness, there's no way I can think of him as my president. And so, not everyone would agree, but this is the president of the United States. And who said a government should aim to give all people under its jurisdiction the best life possible? I don't know. Frances Perkins. The first woman to be a secretary in a presidential cabinet, and the woman behind Social Security labor laws and the like. So I'm going to summarize what I have to say today. I'll show a few slides, and I'll be very happy to send slides to anyone or make them available. The story is, we have a system that works, and I'll show you a couple things about how it works, but it's almost seamless. Not perfect, but seamless. We can almost think of it as the highway system. It's a system that functions, and like the highway system, if you run, there are going to be bumps in the road. But when you run into a bump in the road on the highway system, what happens? Do you tear it up? Do you start running around? The highways ought to be torn up. No, you fix it periodically. You adjust it. Same thing for Social Security. Yeah, there are bumps in the road. If we have universal health care, there'll be bumps in the road. You adjust it. But bottom line is, this is core. It's part of the infrastructure we require to be civilized. Yes, there's a modest financing problem. It's really quite addressable without cutting any benefits. We can ask millionaires and billionaires to pay the same payroll contribution on all their earnings, plus their interest assets. Their interest and assets. Do that, you've got most of it. And there's a lot of other stuff. We're not a poor nation. There's a lot that can be done to help expand it. Solvency, again, just like paying for universal health care. It's important, but the end is some human values and how people are cared for and care for themselves in our society. The crisis rhetoric has to be understood as a purposeful attempt to pull apart public support for the system to drive wedges between different people. The one I love is young versus old. Let me just say, how many people have grandchildren here? How many of you hate your grandchildren? That's what they say. They say you hate your grandchildren, you don't care that they would cut Social Security. The strategy has been, tell older people and people in their late 50s, don't worry, be happy, we're not going to cut your Social Security. But then tell the young people, it's not going to be there. There's been an ongoing campaign to pull apart public confidence in the system, and it's been successful, and yet this is hugely supported. If you go across polling data, Republican, Democrat, all of them do not want Social Security cut. About 80% on total, 70% maybe of Republicans, 82 of Democrats, 83. Bottom line is they're willing to pay more for it, and they want to see it expanded. We face an unprecedented threat to Social Security, Medicare, and Medicaid. We have an administration that's prepared, and a Congress that we've just seen is prepared to do anything to undermine core institutions in our society. Look, they've managed to squeeze income out of the middle class and out of poor people over the last 40 years. The economic productivity that we've had since 1950 has been about, on average, 3% a year. From 1950 to 1980, 2/3 of that productivity increase went into wage increases for the bottom 90%. From 1980 to today, none of it. It's all gone to the top 10%, and in fact, more than that, because the middle has lost. Meanwhile, we're growing in spite of the rhetoric. So what we're facing is a crisis in inequality, not a crisis in Social Security. What we're facing is a retirement income crisis. 2/3 of working Americans today, young people, middle-aged people, will not be able to maintain their standard of living in retirement. That's a crisis. And it's especially a crisis for young and middle-aged people, but it's also a crisis for today's old. Not everyone is living high on the hog who's old. Expanding Social Security is not a matter of what we can afford, it's a matter of political will. And there's a longer story behind it. I'll get to a little bit of this as we go along. But at core, again, there are a set of values. And that's, I'll say, I'm a Social Security wonk, okay? I'm also a Social Security activist and a political activist. At core for me, the reason I see Social Security, universal health, Medicare, and Medicaid is important is because they're instruments of civility in a very indecent world at the moment that we're facing. So that we really, and they pull down other things as well. So let me go to the next slide. Oh, but I didn't even go to that slide. I'm working off of mine. So I would tell you about where we've been, where we're going, where we've been, if I had another 25 minutes, but I don't. So I'm going to keep it, we have about 5 minutes? What?
I'm going to ask if our next panelists are even here.
Yes, and it's actually singular because Gay is sick. So if you want to take an extra 5 minutes, go ahead.
Okay, thank you. I owe you. So, we have a system that works, and I want to make this point also because politically I think there's some important things for progressives to understand from this. We built this system because it enables us to do some things, provide some surety of protection that we can't do by ourselves against risks we face. Now, how many, it's loss of income due to retirement, disability, death of a worker. How many people here have benefited in one way, or how many people here have lost a spouse or lost a parent? Jeez, sorry. But as children, those of us who did benefited from Social Security. It's core life insurance, and you don't want to learn that, but it is. I'm saying we usually learn it when something bad happens. It's something we build from generation to generation, and it works. It's the safest, most secure system and widespread protection we have. You know, you look back to the retirement, you look back to the near economic collapse of our country about 7 years ago, and we saw pensions go belly up, we saw jobs be lost, housing be lost, income savings, the savings of people. The one thing no one had to worry about was Social Security. It works, it makes its payments, it doesn't miss it. So, a lot of money. It's a lot of protection. It's survivor's protection worth $500,000, $600,000 for a family with a couple of young children, or adult with a couple of young children. It's something that moves from place to place. And there's a lot more I could say, but I'm going to show you one thing which is important. Yes, there's 60 million people who received benefits in 2015, but I want to bring it down to Representative Tenney's district. This will give us an idea. There are 710,000 people who live in New York 22, where we are today. 1 in 5, actually almost 1 in 4, get Social Security benefits. Rural areas are more dependent on Social Security. There's about $2.54 billion that goes into this district. They're the same people who are going to talk about privatizing it for our kids. They use nice words, person, or they're going to talk about how we have a crisis and we have to act now. They want to fix it. I say they want to fix it sort of the way my dog Casey was fixed when we sent him to the vet. But that's their notion. They want to say it's broken and then come up with a fix that doesn't work. And that's been a very purposeful strategy. Again, there are these core values that are so important, and some of them are religiously based or ethically based. We have obligations to care for our parents, our family, to work hard, but if you work hard, you ought to get something. And human dignity is at the core of the system as it is at universal health care. So there are these 4 periods. I'm going to tell this story very quick. Early on, we see a battle for Social Security that comes to fruition in the midst of the Great Depression. As soon as the act is passed, Alf Landon, who's running against Mr. Roosevelt, is saying, this is a fraud on the working man. It's socialist. It's non-American. Well, that was the attack on Social Security, but by the 1950s, there was broad consensus that this system works, and it's good for the country. And we have this period of institutionalizing the system and also expanding it in different ways. This is our President Eisenhower, who the more I learn about him, the more I like him, even though we know he was a segregationist. What I like about him is that even though he was that, he believed in the law of the land, and he desegregated, he federalized the National Guard to desegregate the schools in Little Rock, Arkansas, when the governor was trying to support the segregation. He also said this: should any political party attempt to abolish Social Security, unemployment insurance, and eliminate labor laws and farm programs, you wouldn't hear from them in the future. Of course, there are a few folks like H.L. Hunt. Today that's Koch brothers. It's Pete Peterson. It's Mr. Trump. There are a few folks who believe that you can do those things. H.L. Hunt and a few other Texans, but they are few, or their number is negligible, and they are stupid. That was how things worked back then. They understood this. So, the next period, so we see this expansion of Social Security from 1950. We see Medicare and Medicaid passed. We see benefits increase because, in fact, older people were in very low income. We see a tremendous effect. But somewhere in the middle of that, we have financing problems as the system matures and the baby boomers start retiring. And we see two laws that involve some benefit cuts and some payroll, some contribution increases. They were trying to say the system's going belly up and whatever, but it didn't. So the new strategy was, there was right after the 1983 amendments, 4 years ago, I know, the Cato Institute, a libertarian far-right institute, held a conference about how do we pull apart Social Security. And there's this wonderful article called A Leninist Approach to Deconstructing Social Security, out of a right-wing group. And their story is basically, tell the old folks don't worry, tell the young folks it won't be there, make alliances with the banks, work on undermining public confidence, and that's pretty much what happened. From that period forward, what we've seen is the new attack was, it's not fair again to young people. I was a young people then. It's not fair to poor people, it doesn't eliminate poverty. It's not fair to rich people, they can put their money away and make more money. Not necessarily true, but that's the argument. It's not fair to anybody. Well, that kept going, but then at a certain point, they figured something. Bush pushed for privatization, the public learned about that, but they learned about something else too. Instead of saying it doesn't work or whatever, they start saying, I love Social Security. But it can't work in its present form. And that's the new attack that's been there. And what we're going to see now is Mulvaney, the OMB director, is going to talk about how to, in order to protect other programs, because you can't take money from defense and you can't take money from tax increases. In order to protect everything else, we've got to eviscerate Social Security, Medicare, and Medicaid. Not so. So, this is what we face. And you notice, I didn't plan it this way, but they're the downturn folk. They're upside down smiles. It sort of says something. But we face this threat. It can be beat. We beat back the proposals to cut Social Security by bringing the voice of Americans into Washington. We lobbied. We built infrastructure that continues to work. Social Security works in a coalition. But the key thing was bringing the voice of the American people in and fighting for it. And with that, building power to not only maintain it, but to expand it, but also to cross generations, because the folks who are most at risk are the young. I'll stop there, if you allow me to.
Is this working? Hello, hello? Okay, we can take some questions from the audience. I saw this hand first.
Thanks so much. My name is Christina Sunsire. I'm from Chemung County. And my question really has to do with persuasion of the New York Health Act. We've got a robust discussion going on in our county right now. We approached our legislature to pass a resolution about the New York Health Act. And what we expected is they came back with us on the data. So it's not, the discussion really isn't on the value end, but it's more on kind of what Margaret was talking about. And so my question is sort of twofold. Number one, the Gerald Friedman economic analysis has come under attack from a lot of different entities. In fact, what we got back was a report from the Empire Center, which is a right-leaning group, undermining the economic conclusions that he drew. So question one is there another source we can look to so that we're not relying only on one economist's findings? Because it just seems like it's pretty easy to attack. And number two is, when you had the graph up that showed the funding of New York Health Act, one of the line items was federal funding. And what we just saw in the 22nd District, the 23rd, was this Collins Amendment that talked about Medicaid reimbursement, and it's a good thing. It opened up a discussion about Medicaid reimbursement elimination, which we're all for. How would you guys encourage us to best turn that discussion on its head and incorporate the Medicaid reimbursement elimination into a support of New York Health Act?
Well, I guess the first thing I'd like to say is one of the basic truths is that New York State is a wealthy state. So this financial analysis, for example, it's a starting point, I think, and nothing would be easy in terms of transformation. But the wealth is there and the principle is there. I think everybody got nervous thinking about the ACA being repealed because especially according to this analysis, New York State would depend quite heavily on the federal government paying for Medicaid and Medicare. I'm not quite sure where you were going with the Chemung County stuff. I know that right now we have a lot of systemic problems. So the counties are mandated by the state. It's one of the few states in the country. Albany requires that each individual county contribute to Medicaid, and I know what some of the numbers are. I think for Chemung County, it's probably one of the highest, if I remember correctly. So I think that there are a lot of financial problems. Where else could we come up with the money to help fund this? I'm not sure I have the answer, but I think that as a starting point, this analysis is exactly that. It's a starting point, and I think it's doable. Does anybody else?
Does anybody know, maybe there's other people in the audience who know if there's other academic research with the numbers besides the Friedman? We got some other experts here on that.
Well, at least as far as the federal bill, there's been a pretty good look at number crunching for a federal bill as well. And there's just no question but that the administrative savings of a Medicare for All plan will save money. I mean, there's no question about that. Now, we all saw with the recent fight for the AHCA, what that was about tax relief for the wealthiest. Right. That's what it was about. So I think, and so all the arguments against the economic analysis are about that, about saving money for the wealthiest people. And yes, in order for the New York Health Act to work, the wealthy, we need that progressive payroll and non-earned income assessment. So, I guess the argument would be around values and what we want, to provide for people. Because you really can't argue with the numbers, except that we're up against some very, very powerful, wealthy forces. And that's, what we have to keep in mind, I think.
I was at a conference yesterday, and the stories are very important. There was a young girl who has Addison's disease and is extraordinarily dependent. That's a disease that President Kennedy had. for those of us who are over 50, 60 years old. But she talked about what it meant and how she would die without this medication, and what the Affordable Care Act meant to her. And her mother did too. So I think those stories are huge, and I think that's what impacts the people in the county legislatures, bringing someone there who's willing to tell the story. And there are a lot of stories, we all have them in our families.
Let me say one more thing also, because we found with our Senator Tom O'Mara, who's a very conservative Republican, one of his priorities is the opioid addiction problem and getting money for more services for people who are addicted. And there's just no question but that those monies depend on Medicaid. And so that's another priority, a leverage that you can use, is that all those people would be covered by the New York Health Act, and the counties wouldn't be responsible.
So, I'm just going to give you a quick source you should be looking at, the Roosevelt Institute. The Roosevelt Institute is where you should be looking. Marshall Steinbaum is probably the main person you should be going to for this information. Just for everybody in the room, I don't want us to delude ourselves. I work at an academic institution, I work for an economist. I would be lying to you if I told you that academics agree on what is good for our country, and that is because they are humans just like everyone else, and many of them have ideological preferences for one position or another. So we should be aware that there is not going to be a sort of single standard to work on in this issue. Gerald Friedman's paper was in many ways groundbreaking. He was pushing against a sort of status quo narrative that has said up until now that government can't provide some of these services. We're seeing obviously where the momentum is going, and if you want an encouraging sign, the most recent literature in the field right now is starting to concede that he may have had a point. But this is somewhere where we need to understand that it's not as though we can appeal to academia on high to give us an objective point of view. So, but Marshall Steinbaum and the Roosevelt Institute is a good place for you to go to start.
Yeah, I'd also like to say I think that it's not exactly a Pandora's box, but it is like once you begin to closely examine one issue and then how it's connected to other issues, and look at our values, and we do place a high value, and we do place a high value on medical service delivery. But when you start to compare, you can see how much it's valued, but it's also like the people who run our big medical institutions make a lot of money. The cost of healthcare delivery is a real expense. We have to look not just at what it costs us to receive healthcare, or the right for people to receive healthcare, but a lot of other issues. The thing is, don't be afraid. Take it apart, look at it, let's get the work done.
I'd like to welcome you to initiate conversation with these people during the lunch period. We're going to be eating in a separate cafeteria, but I do want to give the time that he's already given you 15 minutes of his time, so I really want to get our next panelist up here. Thank you very much for your time. And Mary is going to do the introduction.